So in terms of why would that happen, the science isn't super great. Silicone allergy, and both silicone and saline implants have a rubber, solid silicone rubber shell. It's felt to be extremely uncommon or rare to have a true allergy to silicone, but there are microscopic amounts of trace metals and other substances within the implant shell and the implant material, just as there are in any other implants that we have in our body. And so that is known to be there, and perhaps that could be a factor. The bottom line is, I think it is very good to be aware of the possibility of breast implant illness. And for sure, we don't want you to get a breast implant for a couple of reasons. One is, if you can't face the fact that the implant has some possibility, then it might need to be removed for some reason. One very unlikely but possible reason would be breast implant illness. Another would be you have problems of another nature, such as recurrent problems with capsular contracture or other issues. Both of those have been extremely uncommon in my experience. It's unclear, even with our science and the FDA's review of this, but there is this general recommendation to consider not using a silicone implant or alternatives if we want to use an implant if we have a history of autoimmune disease. So I have a discussion with my patients of whether using a silicone implant makes sense, whether using an implant at all makes sense, and in every case, that very significant discussion of, hey, if we're going to use an implant, I think it's not likely that it would cause problems. I think it would, in fact, be quite unlikely. But if that we ever suspect it may be, that we would want to take the implant out. And then there's another option, which is to use a saline implant. But again, it does have that silicone rubber shell even for a saline implant. And there is another sort of in-between implant that is a saline implant. But rather than the traditional saline implant, that's like the wavy waterbed that you jump in and makes waves, this is like the waveless waterbed version of a saline implant. Has baffles in it so that it feels much more like a silicone implant. It's called the ideal implant, although there is no ideal implant, and it has much more of the characteristics of silicone. So I do recommend using the ideal saline implant for patients that have a history of autoimmune disease. Although I have used silicone implants in such patients, and I have not run into problems where we've had to go back and take those implants out, but it is an important consideration for surgery. Are silicone implants dangerous? Well, I'll go back to the fact that we're placing an artificial device in our body when we place the implant. So I would start with, why would we use it to begin with? Because if we didn't need to use this, we wouldn't want to use it. The bottom line is we use it because we get such great results and tremendous satisfaction. Our patients reach their goals, often exceed their goals in the quality of life, their happiness, their confidence, their reasons for wanting to do their surgery are often very well achieved with a silicone implant. It gives lots of fullness to the upper pole, gives us increase in size, and gives us volume that we can't get with any other method, including fat grafting or other methods that I can think of or that are available. So, safety. It's all relative. We know that this artificial device will likely be replaced at some point in the future. We just don't know when that could be. It could be early in the post-operative period, uncommon, but we do see it and it is possible. It could be many, many years, past 10 years, even past 15 years or more, if everything is going fine. The breast is still pretty and we like it, and there's no problem with the implant having worn out. So the safety of implants in terms of health factors is overall quite excellent. Any reactions, illness from implants, there are rare cases of illness or problems with silicone in the body, but with the current generation that have been around now for decades of the gel implants with silicone, those are really not quite impossible, but we would have symptoms with a ruptured silicone implant, with the body noticing a change with the shape, discomfort, something, before we would have a true problem with that silicone migrating out into the breast tissue and damaging that breast tissue in just about every case. So overall, health-wise, safety-wise, an excellent device, but there's nothing that is fully safe that has no problems. Saline versus silicone. Saline's hiding out here because saline outside of the body actually evaporates through the shell. So I'll take this out. This is the ideal manufacturer baffled saline implant. So it's the waveless version the waveless waterbed version of the implant that has baffles in it. It's a nicer saline implant versus a traditional saline implant in that it doesn't make as many waves. It's more like a silicone implant. I say it's about 2/3 of the physical characteristics in terms of not showing as much wrinkling or rippling and feeling more like the nice soft gel fill of the silicone implant. Most of our patients choose the silicone traditional gel implant. It probably does feel the nicest. And then if we're just not wanting to use silicone or prefer the saline implant, we will then default to the saline. I would say probably 90% of my patients end up choosing silicone, about 10% end up choosing saline. Breast implant sizing is always a very personal choice. Most women have a fairly similar description of what they want, often something natural, definitely not too big, something that gives them some perkiness and a pretty shape. Some version of that almost every woman has a goal of, but what it means for that individual is very different person to person, and what's important is what it means to you when you're sizing. We do three-dimensional sizing. This is a patient that's given us consent, and I've done some finger paint here over the nipples so that we can get a better picture. We've got this in 3 dimensions, and the benefit of this is once we zero in on those goals, we can try on implants here digitally, and it digitally adds implants then to the breast. With that, it's always what I call a video game. It's a simulation, but it's done mathematically. So the breast implant is added mathematically to the volume and somewhat to the shape of the breast, and that is quite helpful then in comparing to what your goals are. So we see the breast grow, and then we can make a comparison of your initial picture to a simulated implant and can compare. So for this person, that might be perfect. For someone else, they may want to compare to a larger implant. We can look at it in different perspectives, and we found this to be far more helpful than even, say, trying a sizer implant inside the bra and helping us zero in on the best sizing options for you. We've identified a number of ways of placing a breast implant, whether it be under the armpit, around the areola, underneath the breast. Most commonly, if I'm just placing an implant, I'll use an incision below the breast. I use that incision for a few reasons in working to get as much control of the pocket position, the shaping of the cleavage area and controlling the pocket, but also controlling the position of the pec muscle. So I like to go under the muscle most of the time. And when we do that, I like to release the muscle in a way that allows it to rise up slightly so that we have less unnatural movement of the pec muscle when we flex it, because we don't normally have breast volume where we place an implant under the muscle, because normally our breast volume, our breast tissue is on top of the muscle. So to get control of all those factors, it's hard to do it from above. It can be done from around the areola, but probably not as simply or as accurately. And I also like to secure the position of the bottom of the pocket. I can get the most control doing that from the incision down below, getting a controlled pocket, and that's the incision I prefer for breast augmentation. Now, when we're doing breast lifting, there's a variety of incisions, but I'm probably known for doing significant amounts of breast lifting and being really demanding of that procedure to get significant, bringing the breast back up onto the chest if it's very, very wide, and if it's very low, significantly lifting it back up. So I place the implants first when I'm doing breast lifting with somewhat of a plan for exactly how I want to lift the breast, but I haven't finalized that plan. I then shape the breast up onto the chest and do a significant amount of work to shape that to get a very high and rounded shape if that's our goal. And for many of our patients, that is the goal, is to get a very high and rounded shape, probably leading to the most common comment I hear after surgery, which is, I really love being able to basically cheat and have a really nice looking clothes or a top where I don't have to wear a bra, but it kind of looks like I am wearing a bra, or I just have a nice full shape. That can be a great change when you're used to having a breast down here that you have to lift up to put into a bra. So bottom line is it will vary under the breast for just an implant, up to a full breast lift incision with longer scars, more like an anchor shape if I'm doing full lifting of the breast, and then in between for lesser amounts of breast lifting.